Hello, my name is Gwen McMillin, and I'm a professor of pathology at the University of Utah, as well as a medical director of toxicology and pharmacogenomics at ARUP Laboratories. Today I'm going to be talking about one of our newer tests, a therapeutic drug monitoring test for Imatinib Mesylate. Imatinib Mesylate, or simply Imatinib, is a drug used to treat some forms of cancer, such as chronic myeloid leukemia, or CML, gastrointestinal stromal tumors, or GIST, and melanoma. Imatinib is a tyrosine kinase inhibitor that was originally sold under the brand name Gleevec, but is now available in generic formulations. First-line imatinib therapy has been shown to extend the life expectancy of CML patients to approximate that of the general population. And imatinib has been shown to significantly improve progression-free survival for many GIST patients. In addition to well-documented efficacy and a favorable safety profile, Imatinib offers convenience to the patient because it is an oral therapy that is self-administered. There are several factors that influence the therapeutic success of Imatinib. First, the dose and dosing frequency need to be tailored to the patient. The dose is selected based on the disease characteristics, as well as patient factors such as body size, comorbidities, concomitant medications, as well as what we know about Imatinib pharmacokinetics. Second, Imatinib needs to be taken as prescribed. Non-adherence is a major challenge with any chronically administered oral drug. The reasons for non-adherence may include forgetfulness, personal beliefs about taking medications, socioeconomic factors, side effects, and toxicity. A third factor that affects the response to Imatinib is regular monitoring. Cancer can become resistant to Imatinib due to secondary mutations in the associated genes. A person's pharmacokinetics and adherence patterns can also change over time. ARUP Laboratories offers several tools to help monitor patients that are prescribed Imatinib, the newest of which is our plasma Imatinib immunoassay. This newly developed test has an analytical measurement range of 300 to 3,000 nanograms per ml, and the results compare favorably to results generated by tandem mass spectrometry, or LC-MS-MS. Strategies for using the plasma Imatinib test include routine adherence monitoring, dose optimization, and evaluating the reasons for resistance to therapy. Indeed, a patient's disease could progress due to non-adherence, underdosing, or changes in the cancer that lead to resistance to Imatinib. When pursuing Imatinib TDM, we recommend collecting a pre-dose, also known as a C-min or trough, venous blood sample using a potassium EDTA or a lithium heparin tube. Once the blood is collected, the plasma should be separated from the cells by centrifugation and then transferred to a standard transport tube. The plasma should be stored refrigerated or frozen until tested. The proposed therapeutic target for plasma Imatinib in CML patients is 1,000 nanograms per ml, and the proposed therapeutic target for GIST patients is 1,100 nanograms per ml. These therapeutic targets are based on steady-state monitoring and are supported by results of several clinical studies, such as those referenced at the end of this presentation. These targets are also consistent with the proposed guidelines for Imatinib TDM that were presented at the 2017 International Association of Therapeutic Drug Monitoring and Clinical Toxicology Congress. In addition to improving efficacy and safety of Imatinib through TDM, routine monitoring of Imatinib may yield pharmacoeconomic benefits by improving patient adherence and identifying changes in pharmacokinetics that could contribute for therapeutic failure. In summary, plasma monitoring of Imatinib concentrations can help assure adherence to therapy and support dose optimization for CML and GIST patients. Please contact ARUP Laboratories for more details about this exciting new testing opportunity. Thank you.